Hi, my name is Sylvanna Murillo, and this is my presentation for Health Psychology 532, and it is titled Obesity, a Biopsychosocial Perspective. In this presentation, I'll explore obesity through a multidimensional lens, looking at biological, psychological, and social contributors to its development and maintenance. I'll also highlight evidence-based treatments and introduce a key assessment tool used in both clinical and research settings. Obesity is a chronic condition that involves the excessive accumulation of body fat. It significantly increases risk of various health conditions such as heart disease and diabetes. According to the CDC, over 40% of the U.S. adults are classified as obese. In this presentation, I'll use the biopsychosocial model to deepen our understanding of obesity, focusing on causes, consequences, and treatment. Obesity is a multifactorial disorder. It requires a variety of treatment methods, including medical, behavioral, and psychological strategies. We'll also examine the role of the body mass index, which is known as BMI. It's a common clinical assessment tool. It benefits, limitations, and how it supports diagnoses. Finally, I will introduce two coping models, the health belief model and the trans-theoretical model. There is no single cause of obesity. It results from a complex interplay between genetic, behavioral, and environmental factors. A consistent energy imbalance, taking in more calories than are burned. It can lead to weight gain, but it's rarely that simple. Understanding the diversity of causes is essential for tailoring effective treatment. Genetics can influence metabolism, appetite, and fat storage. Hormonal imbalances such as leptin resistance interfere with hunger cues. Neurological pathways tied to reward can reinforce overeating. Even sleepiness and disruption to circadian rhythms are linked to obesity. Emerging research also shows the role of gut in nutrient absorption and weight gain. Psychological elements play a critical role in obesity. Emotional eating often stems from stress, anxiety, or depression. Negative body image and low self-esteem can lead to further unhealthy behaviors. Cognitive patterns like all or nothing thinking can hinder efforts at weight loss. Mental health challenges must be addressed as part of a holistic treatment plan. Social determinants such as income, environment, and culture significantly influence obesity. Limited access to nutritious foods, unsafe neighborhoods, time constraints, and culture beliefs all affect eating and activity levels. Media influence and weight stigma can further isolate individuals and reduce their willingness to seek care. These factors don't exist in isolation. For example, a person with a genetic predisposition may engage in stress eating due to a job-related pressures, leading to weight gain and depression. This cycle reflects the need of multidimensional care. The biopsychosocial model promotes more personalized, empathetic interventions. Obesity increases the risk of chronic illnesses such as diabetes, heart disease, and stroke. It also contributes to joint pain, reduced mobility, and sleep apnea. Psychologically, it can result in depression and low self-worth. Socially, individuals may experience discrimination, bullying, and decreased quality of life. Effective treatment starts with accurate assessment. Tools like BMI, waistline, and clinical interviews help evaluate the severity and factors of obesity. Psychosocial screenings identify emotional or environmental barriers, allowing providers to tailor interventions accordingly. The OP scale is a self-reported measure that evaluates how obesity affects areas like work, self-esteem, and relationships. It uses a Likert scale and is widely used in both clinical and research settings. This tool helps providers monitor treatment progress and address specific psychosocial challenges. Obesity treatment must be multimodal. Cognitive behavioral therapy addresses thoughts and behaviors, while medications such as GLP-1 supports appetite regulation. Nutritional counseling and individualized exercise plans are also key. Treatments are most effective when culturally sensitive and patient-centered. Behavioral strategies include self-monitoring, goal setting, and stimulus control. Rewards and positive reinforcement enhance motivation, while problem solving helps address barriers. Group programs can offer social support and contribute to lifestyle changes. Medical treatments may include appetite suppressing drugs. For severe cases, surgery can lead to a significant weight loss. However, surgery requires long-time behavioral changes and psychological readiness. Ongoing support is essential for maintaining results. CBT remains the gold standard for addressing psychological factors in obesity. Other approaches like ACT and motivational interviewing encourage mindfulness and behavior changes. Family therapy and group counseling can help break cycles of unhealthy habits and reduce stigma. The HBM explains how health behaviors are influenced by beliefs about risk and benefits. To promote weight loss, individuals must view obesity as a serious health threat and believe that changes is achievable. Intervention often involves education, feedback, and building self-confidence. To improve adherence, providers can use personalized data, success stories, and simplified goal settings. Mobile apps and regular follow-ups can serve as cues to action. Reinforcing positive outcome boosts confidence and long-term motivation. The TTM describes behavior change in 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. Individuals often cycle through these stages. Recognizing where a person is in this process allows for tailored, non-judgmental support. Motivational interviews helps individuals progress through early stages. In later stages, action plans, SMART goals, and regular check-ins support progress. Relapse is common and should be addressed with compassion and problem solving, not judgment. In conclusion, obesity is a complex chronic condition shaped by biological, psychological, and social factors. Addressing it requires comprehensive assessment and multidisciplinary treatment. The health belief model and trans-theoretical model offer valuable frameworks for guiding changes. By applying a biopsychosocial approach, we can offer more empathetic and effective care that supports long-term health and well-being.